I'm Dr. Melanie Ornstein. I'm an obstetrician-gynecologist. I'm going to talk today about what it means when you don't have your period. There are two types of amenorrhea. Amenorrhea meaning I don't have my period. Primary amenorrhea means you've never gotten a period. And secondary amenorrhea means you have periods and then they stop. If you haven't had a period yet, maybe it's just that you're not old enough. Even though some of your friends may have their period, you may not have progressed that through puberty at that point. Periods usually come around 2 years after breast development. If you've had no period ever, it again may reflect different hormonal problems. Maybe delayed puberty. Sometimes there's a syndrome called polycystic ovarian disease or polycystic ovarian syndrome. Sometimes people go into early menopause, which is known as premature ovarian insufficiency. Or they have a problem with their thyroid. Or prolactin elevation, prolactin coming from your brain, from your pituitary gland. Or problems in an area of your brain called the hypothalamus. Maybe there's a genetic or a chromosomal abnormality like Turner syndrome. Maybe you were born with part of your reproductive female organs missing. Or maybe you were born with a problem or an abnormality with the vagina or the hymen. This might present with no periods, but you might actually get pain every single month. If you have never had a period, you need to see your doctor and have some investigation. If you had periods and then they stopped, this is called secondary amenorrhea. Like with primary amenorrhea, it might be a hormonal problem, polycystic ovarian syndrome, premature menopause, natural menopause if you're over the age of 45, thyroid problems, prolactin elevation. Stress may relate to missing a period. Stress can affect the functioning of your hormones, and people can experience psychological stress or physical stress from a chronic illness. People who participate in very intense exercise, rigorous training may lose their period. This might be from having a very low body weight or from stress or from just very high energy expenditure. As an athlete, it's important to maintain a healthy diet and a healthy body weight. If someone vomits a lot, it is possible that they have anorexia or bulimia, and this can affect hormonal function and it can stop periods. And usually with weight gain to a healthy body weight, your periods will resume. Some medication may affect your period. For instance, if you're taking a birth control or a contraception that is progesterone-containing IUD or birth control, or you've taken a regular birth control pill containing estrogen and progesterone for a long time, or you don't take breaks, then it can happen that you don't have a period or you miss a period. Some antipsychotic and antidepressant medications may have this effect, and cancer chemotherapy medications. If you've had a surgery, you may experience a lot of physical and emotional stress from the illness, from the surgery itself, and that may cause your periods to stop. If you had surgery in your uterus, for example, what we call a D&C for a miscarriage or a termination, or a hysteroscopy to remove a fibroid or a polyp inside your uterus, this may have caused some scarring. Obviously, if you surgically remove your uterus, having a hysterectomy, then you will not also have periods. While breastfeeding, it's very common not to have your periods. This can last for a variable amount of time, even up to a year or more if you're exclusively breastfeeding. It does not mean you can't get pregnant, however, because even if you're breastfeeding and not having a period, you still may release an egg, so you've got to use contraception.